Tobacco is a very, as a taxation policy, we always tax it. We always increase taxation every year. That is what the policy at the Treasury targets. Of course, working together with KRA, then we are able to, every now and again, to implement and develop tax policy measures on tobacco every year. But despite us increasing it every year, they still smoke it every year. So maybe it's an addiction. But I believe the team here, working together, would come up with some policies that would actually maybe streamline that area of tobacco. So, ladies and gentlemen, distinguished guests, all protocols observed, it is my pleasure to preside over the launch of the 3rd Annual Taxation Conference, an important occasion to reflect on socio-economic issues relating to the use and regulation of tobacco in our society. I wish to thank the organizers of this event for their good work and participation in the fight against use of tobacco products. Ladies and gentlemen, studies suggest that the use of tobacco started around the 1st century, when Maya people of Central America used tobacco leaves for smoking in sacred and religious ceremonies. To date, this crop is still part of our lives, both in social and economic aspects of our contemporary society. The harmful effects of tobacco use in the society, of course, cannot be overemphasized. With the increasing negative health outcomes like cancer and lung diseases, equally, the socio-economic effects such as nicotine addiction continue to plague the society. On the other hand, tobacco as a cash crop continues to sustain the livelihoods of many households, not only in Kenya, but across the globe. This poses a huge dilemma on whether to ban the use of tobacco or support growth of the sector for economic gains. Ladies and gentlemen, according to a report by the World Health Organization, Kenya is among the top 10 tobacco leaf producing countries in Africa and came second after South Africa in cigarette exports in 2018. This shows that tobacco sector continues to contribute to our GDP through job creation, foreign exchange earnings, and revenue contribution. Despite the positive contribution to our GDP and economy, tobacco continues to pose significant harmful effects in the society. These include lung diseases, including cancers, as well as the nicotine addiction that has seen many young people get hooked and derailed from achieving their full potential. The negative effects of tobacco use are not news to any mature person and is unacceptable behavior in our society. However, manufacturers have devised new ways of packaging and delivering the nicotine that are meant to appear more elite, thus attracting the youth through marketing deception. These techniques include the e-cigarettes, nicotine pouches. Nicotine is also sold as skin patches, chewing gum, nasal and oral sprayers, inhalers, lozenges, and tablets. That is the changing form of tobacco in our society. In Kenya, electronic nicotine delivery system and electronic non-nicotine delivery system has been on the rise, which has led to increased use among teenagers. Many countries and regions have started to regulate the electronic nicotine delivery system and non-delivery system. Kenya being among them, the government has also introduced taxation on end products, including e-cigarettes, as part of its broader strategy to regulate and discourage the use of these products. To curb the negative effect from the use of tobacco, the government has put measures to discourage the use of these products. These include banning the advertisement of these products, including health warning in the packaging, and imposing consumption taxes like excise and VAT, and also import duty on cigarettes imports. One of the key challenges in tobacco policy is striking a balance between reducing tobacco consumption and raising revenue, not forgetting the pushback by the tobacco industry. There is no policy that is enacted by the government on tobacco sector that is implemented without being challenged in the court. So that's one area that we also need to be alert of. The medium-term revenue strategy proposes various tax reforms, including harmonization of taxation of filter and non-filter cigarettes under the East Africa Community. Discussion has been ongoing to change the taxation regime of excisable goods and base it on the negative health externalities of the respective goods. Kenya delegation has been participating in these meetings, and they have been going on. We hope something fruitful will come out of those meetings. The government has also, under the Ministry of Health, put policies for tobacco controls through enactment of Tobacco Control Act in compliance with World Health Organization Framework Convention on Tobacco Control. The ministry has imposed a levy on the tobacco payable by the producers as well as importers of the tobacco for use in the implementation of tobacco control measures. The success of these measures requires enforcement, public awareness, and such forums as this in addressing challenges associated with the use of tobacco products. We encourage stakeholders and members of the public to support the government and be part of the change required to change the behavior of citizens in tobacco use by sensitization, participation in sharing views and giving policy proposals during policy formulation, including taxation of tobacco products. Ladies and gentlemen, the outcome of this annual conference will be very important and will be taken into account during review of tax regime in taxation of tobacco products. So we wish you well. We wish you a fruitful discussion, and remember, we are waiting for the outcome so that we can also integrate it in the policy to come. Thank you very much. Asanteni sana.